Hi, I'm Dr. Matson. Today we're going to be talking about population health for nurses. Specifically, we're going to be covering Chapter 8, which is social determinants affecting health outcomes. And this is following the OpenStax textbook. So, as an overview, we're going to talk about economic stability, the neighborhood and built environment, educational environment, access and quality, and the social and community context, as well as the cumulative effect of inequalities on health. So, in the United States, clinical care accounts for just 20% of a person's health outcomes. Social and economic factors and health behaviors and the physical environment, those are actually responsible for the remaining 80% of health outcomes. So that means that a person's zip code has more bearing on health than their genetic code. Social determinants of health are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems that shape the conditions of daily life and influence health outcomes. So here what you can see is that we're looking at access to quality. So these are all part of the social determinants of health, the neighborhood and the built environment, green spaces, the homes, the stores, social and community contexts. So that would be the activities that are going on in that area, the kinds of organizations. So economic stability, how are the businesses doing? What is the median and mean income? And then the education, so the quality of the schools, and how people can become a part of that school. So for you, what you want to be able to do by the end of this lecture is be able to discuss the relationship between poverty and economic insecurity and describe the impact of employment on economic stability, and also be able to explain how housing instability contributes to economic insecurity. And then you also want to be able to describe that relationship or link between a person's socioeconomic position and their health. So, economic stability, when considering the social determinants of health, this is really the ability to access resources and care and promote healthy living. So, when we think about this for an individual or family, this is the state where a person has a steady source of income, regular access to resources for a healthy life. So, are they able to exercise, go to the grocery store that provides healthy foods? And then in order to do this, they have to live in a place that they can afford, right? So that's where this living wage comes in. For economic insecurity, this is where there is not consistently affordable housing, food, clothing, transportation, childcare, or healthcare. And when those things are not constant, then we're seeing a link to poverty. So in the United States in 2021, up to 12% of the population would be considered living in poverty. The socioeconomic gradient, this is another term for a relationship between income and health. This is the association between low socioeconomic position and increased disease risk and premature death. Generational poverty is a phenomenon where there is persistent poverty and disadvantage. So we can see that people have a tendency to do work or follow education paths that their family and parents have previously done. And in the same way, where we can see that in a very positive way, we can also see where people get stuck into this generational poverty because they're not going outside of that. They don't have the same resources to be able to start to have more education and a higher paying job than potentially their parents or grandparents. The The main driver of individual economic stability is the job. So job demands, that work environment, how much are people getting paid, so that compensation, and then how secure is it? That all of that affects someone's health status. And then when we think about their retirement, it also impacts their leaving, their work. So we think about their employment. Are they employed? Is a person underemployed, unemployed? And this then impacts their economic stability, and then we'll see later also their health outcomes. We know from research that there is disparities in employment, which is correlated with race and ethnic background, gender, and education attainment level. So when we think about this and go into a little more, economic insecurity is correlated with difficulty paying rent, living in very overcrowded residences, frequently moving, and spending a very large portion of their income on housing. So households are deemed cost burden if they spend more than 30% of their income on housing. And in 2019, over 37 million cost burden households in the United States and almost 18 million are severely cost burdened. So they spend more than 50% of their income on housing. So substandard housing is associated with health risks. We see higher rates of asthma, allergies, mental health conditions, and respiratory illnesses. And with severe housing instability, this could result in homelessness. So here, this is an individual experiencing homelessness or being unhoused, and they're, as you can just look at this picture and start to think about how they're at risk for many health issues, which could be related to inadequate nutrition, exposure to violence, exposure to disease, and weather. So when you're assessing for poverty, you should do this in all of your patients. Assessment is that very first step in the nursing process, and that is what you're going to do when you're looking at your patients and your clients, whether they're out in the community or in the hospital. The other thing you need to do is be able to raise some awareness about how prevalent poverty is and what that means in terms of negative health outcomes. Interventions as a nurse would be referral to housing and support programs, looking at subsidies for low-income families, being advocates for promoting health and society benefits, whether that be joining committees, local or regional or national government, screening for physical and psychological work-related hazards. So all of these things are within that capacity of a nurse and a public health nurse. So food insecurity is a condition where people have limited access to adequate amounts of high quality food, and it's also where the food is not consistent or regularly available. It's really influenced by income, employment status, race, ethnicity, and a disability. It increases during periods of unemployment. In 2020, BIPOC households were more than twice as likely as the national average to struggle with food insecurity. People with disabilities had higher rates of food insecurity. And food deserts are areas where there's limited or no options for affordable, healthy foods. And food affordability was a major obstacle for people, especially if they're living in a food desert, and they have higher risk of obesity and diabetes if they're living in a food desert. So the role of a nurse in addressing these food access disparities, so community health nurses should be advocating for people experiencing food insecurities. We see this with school nurses who are at the forefront, who are promoting healthier food options in schools, helping with community gardens, even doing cooking classes. And community health nurses often work with local food pantries to help families and help people have access to good food, and they benefit from these programs. And public health nurses can be at the table where legislation is being made, and they can help influence policies both locally and nationally to try to help limit numbers of fast food restaurants in a community area. So now thinking about crime and violence, this adversely affects people, whether they're directly impacted or they're witnesses. We can think of this in terms of child abuse, firearm violence, intimate partner violence, sexual violence, or elder abuse. Violence has this overall cumulative biological effect on the brain, and within this neuroendocrine system, an immune response. They're physical responses to violence. These repeated exposures to crime and violence are linked to negative health outcomes. So, childhood exposures, particularly to violence, are considered adverse childhood experiences. And people who are economically insecure are more likely to live in areas that lack resources and have higher rates of crime and violence. So, nurses can help be integrated into educational programs that can help build resilience and develop healthy interpersonal relationships, whether this is through screening, being there as a regular school nurse, doing education classes. So, school-based programs can address emotional self-awareness, regulation, problem solving, teamwork, and can also help build this culture of accountability. When we're referring to the built environment, we're talking about transportation, roadways, green space, places where communities can gather, and the physical buildings and structures. Almost 20% of economically insecure households lack access to private transportation. So, more economically insecure people, they can drop out of the labor force because of transportation. And now we can see this whole cycle of what can happen in terms of health when we were talking about economic stability earlier. So the availability of green spaces, sidewalks, bike lanes, these really do have major health impacts. So nurses knowing and being trained and working with these communities are really perfectly positioned to advocate for these shared green spaces. They can do this through building of community partners. Nurses can be working at schools, universities, so elementary schools, middle schools, high schools, universities. They can be working at hospitals. They can be partnering or working at clinics. When we all come together and we're putting together research proposals, we're talking to key leaders and stakeholders, this is where we have that traction, and we have the respect and the position to advocate for places like playground structures, tennis or pickleball courts or basketball courts. We can advocate for more physical education, outdoor recess time at school, because we're talking about, we can see this whole continuum of both their mental, physical, emotional health and well-being. When we're talking about quality of home, so a home's physical condition and quality of its environment also needs to be assessed. So poor housing, we can look at the quality of the homes. Is it falling apart? Is it older? Is there lead paint there? So poor housing quality contributes to negative health outcomes like lead, asbestos, radon. And then overcrowding, you're more susceptible to getting different diseases in areas where there's poor air quality, and you have higher risk of getting asthma, lung cancer, respiratory disease. There's also water issues based on the age of the pipes, like I said, lead, all of these, the actual house itself and its condition is then linked to health outcomes. Again, we see nursing being in this place to advocate for quality housing, to be able to talk about its impact on mental and physical health, and be able to be on these committees that link places that can do research and give health services and education. And part of this could be providing screening for things like lead poisoning, mold related injuries, mental health issues, communicable diseases. They can help write, develop, and advocate for policies that really demonstrate how this is impacting the overall health. And nurses really are well positioned to affect change. So some most common environmental conditions impacting population health are air quality, water safety, and extreme weather. And like we said, poor air quality can lead to respiratory illnesses, lung cancer, and even heart disease. So here what you're looking at is poor air quality. We can think of other places that this has happened. We know in California, right, with the fires, the air quality is impacting health outcomes, both immediate and also long term. So in terms of water quality, we need safe, regulated water for drinking, bathing, and cleaning. It's an important health determinant. Annually, an estimated 7.2 million people contract waterborne diseases, and the Safe Drinking Water Act allows for this environmental protection agency to help enforce standards for quality drinking water. So water quality, this can be affected both by natural and built environment and also some socio-political factors. So you look into the Flint water crisis, right? You have people who are making decisions for cheaper water without thinking about its health outcomes on the people who are living there. When we talk about extreme weather, this could be heat waves. So knowing that if people don't have access to air conditioning and they're older and they're living in this house, this can cause a lot of health conditions, or from a heat wave all the way to a tornado and a flood. So this could be direct injury and death. There can be actual infrastructure damage, and then that takes away their food security and house security. And this is really a fundamental threat to human health and well-being. So nurses, their role in assessing these environmental factors could be, again, policy development to ensure that there are plans in place, there are a way to monitor and assess a population health and investigate any kind of health hazard root cause, educate the public, mobilize these partnerships through research and education, and have policy changes, even if it's at a city level, to be prepared to react in a way that is going to really position the community to have a plan to be able to respond quickly. So now by the end of this next section, you should be able to talk about health indicators and education level and look at implications for poverty and disability and discrimination and quality education, and then really discuss this intersection between social determinants of health and health literacy. So early childhood education, early life stressors, and ACEs impact child health, and this can lead to developmental delays and poor outcomes later in life. So poverty impacts children's academic achievement, and having really early childhood programs, not only is this going to foster both mental and physical health, but then this is going to set them up to be able to read, write, understand questions and language. It's really foundational. They have to have it early on for that ease as they're going into elementary school. And then also the quality of that education is extremely important for their health and well-being. It's their access to resources, and it's also being able to assess and see where the child is and make sure they're learning these key foundational learning principles that they need in order to be successful, because again, we're setting them up for this economic stability later in life that then has this whole round of impacts. When we look at high school graduation, there are disparities in high school completion rates. When we look at race and ethnicity, lowest are for Black and American Indian, Alaska Native students. And we also can see a lack of parent involvement is linked to lower graduation rates. Teacher quality and student perception of the quality really have a high impact. And the reading skill level at third grade is linked to high school completion rates. So positive outcomes are linked to high school graduation. We see decrease of premature death, more employment opportunities, higher lifetime earning potential, and from there we now see health implications. So enrollment in higher education, so in general, college graduates' lifetime earning are double of those individuals without a degree. Of course, the higher the earning, the greater ability to secure material and social resources, and how well an individual's middle and high schools are prepare them for being able to successfully navigate college and then graduate. BIPOC individuals still demonstrate the lowest levels of academic persistence compared to white students in research. So we're looking at these same patterns of where this public health nurse comes into play here. So early on, child primary and secondary education, using assessment data as foundational for influencing both policy level at a local level and beyond in both the county, schools, and in their research, so wherever they're positioned. And through these things, nurses are able to advocate for support and have increased funding for these evidence-based successful programs. When we're talking about language and literacy, so health literacy refers to an individual's ability to find, understand, and use health information. So limited English proficiency can be a barrier to accessing healthcare services. So individuals who say that they have this limited English proficiency are less likely to have a primary healthcare provider, and therefore preventative healthcare, screenings for cancer, heart disease. Also, difficulty in following medication instruction and communicating with health providers. There could be a lack of interpreters and culturally sensitive providers, and that really impacts health. So now you're going to talk about, you should be able to discuss civic participation on individual health by the end of this, really define discrimination and discuss its impact on social determinants of health, explain a little bit about incarceration, how that is linked to other social determinants of health, and the importance of social capital and health outcomes. So when we talk about civic participation, this is a range of activities that benefit the community. And social capital is the value gained from having positive interactions and connections between people working together. So overall, volunteers experience psychological well-being and emotional health. So here you're looking at volunteers in a community garden. They're socializing with residents and having access to healthy food. Now, when we're talking about discrimination, this is really defined as unfair treatment of people and groups based on social perception, characteristics like race, ethnicity, gender, age, religion, sexual orientation, and ability. It's a public health threat It has adverse health outcomes, and it can occur on multiple levels, individually and structurally. Structural discrimination is looking at institutional policy systems and laws, and practices that limit opportunity and resources, and where power is really for certain groups. And it can have a very significant impact on health. Incarceration affects health, so people who are incarcerated and their families and their communities. So we see that on the individual level and family and community. Then BIPOC communities and individuals with lower levels of education are disproportionately affected by higher incarceration rates. And individuals with a history of incarceration have worse physical and mental health compared to the general population. Really negatively impacts their family and those who are incarcerated. And we see nurses working in these systems. So community health nurses can partner with them, can work with the nurses who are working in the jails, and really help identify who's at risk. And then also when we connect this to children, being able to identify children who are at risk because of parental incarceration. So social cohesion, this is the strength of relationship within a community. When we talk about collective efficacy, this is another aspect of social cohesion. It's based on trust and a community's ability to create change and influence behavior through social norms. There are high levels of social support, which positively influence health outcomes such as healthier eating habits, exercise, dealing with stress. And then social networks are foundational to healthy living and a thriving community. So by the end of this, you'll be able to talk about health equity and inequity, describe the context of social determinants of health and its cumulative impact on population health. So health inequities are differences in health statuses and resources based on population groups that can arise from social conditions. And equality are situations where each individual is given the same resource and opportunity. Equity is where everyone is not the same. The resources are distributed by need of the individual to reach an equal outcome among individuals. And to achieve this, individuals and communities can put resources and opportunities in specific areas to help align with circumstances. And you can kind of think about this when we're talking about, the quality of homes, the built environment, how that impacts people's ability not only to access care, but understand it and to trust it and to utilize it. And that's what we're trying to think about here. And that concludes our lecture today.